Okay, hello everyone, and welcome to the next in our series of online seminars from Langara College and the Canadian Holistic Nursing Association. Today we have Mary-Cathrine Campbell, and if you have questions as she goes through her presentation, please enter them into the chat. You'll see on the right-hand side of your screen a chat icon that you can click on. And if you enter those in the chat, we will answer them at the end of the presentation, which probably takes about 20 minutes to half an hour. And I will monitor those for passing on to Mary-Cathrine at the end. Now I'm going to mute everybody's microphone except hers. And Mary-Cathrine, if you can introduce yourself and then share your screen with us, and away we go.
All right, thank you, Judy. Well, hello, everyone. My name is Mary-Cathrine Campbell. I'm a registered nurse, and I'm a certified healing touch practitioner. And currently, I'm also the voluntary president for the international nonprofit organization called Healing Beyond Borders. So, healing touch. I'm going to talk a little bit about healing touch, what it is, how it can be used in various settings. We'll talk a bit about people who are drawn to do this type of work, as well as a little bit of history about healing touch. I'll give you some information about our organization and the process of going through certification. And we'll touch on some of our research because we're very much very enthusiastic about the research that is available on healing touch. And then at the end, as Judy mentioned, there'll be time for questions and answers. So let's get started. So healing touch is a gentle, relaxing energy work that it helps to balance people physically, emotionally, mentally, and spiritually. And it works to support people in their efforts to self-heal. It's safe for all ages, and it can be done in a variety of settings. So the person who is offering healing touch, for them, it's a conscious, intentional process, and energy is directed from their hands towards the patient receiving it to facilitate that person's self-healing. The goal, as we've talked about, is to restore harmony and balance to the biofield, the energy field that surrounds all of us. Some of the things that have come forth with regard to healing touch is that it enhances comfort, it balances body, mind, and spirit, promotes relaxation, increases a sense of well-being, and promotes relationships because it's just a lovely thing to experience and also a lovely modality to give. So here's a picture of one of our healing touch instructors, Sue Cagle, who works in Arizona down at Canyon Ranch. And as you see, Sue is administering healing touch to her client who is lying down on a massage table. But healing touch can also be given in a seated position. It can be given with the person to full body treatment or just one particular area. So an example of this is that there are many techniques for treating different types of headaches. So if a person had a migraine headache, for example, the practitioner would perhaps choose one or two different techniques, and that would just be a kind of a spot treatment that would be given to help with the headache. The person, as you see, is fully clothed, but if they were in the hospital, they'd be wearing hospital garb. People who are receiving healing touch often tell us that they sometimes perceive different things, such as changes in temperature. They sometimes feel very calm and relaxed. It's not uncommon for people to fall asleep when they're receiving a healing touch treatment. And so for this reason, the practitioner is always aware of what's going on with the client as you give a healing touch treatment. Healing touch is one of the complementary therapies that the National Institute of Health in the United States, under the National Commission for Complementary and Integrative Health, classifies as a biofield therapy. And other biofield therapies that you may be familiar with yourself include polarity, therapeutic touch, Reiki, and Qigong. So I'm going to talk a little bit about cure versus healing here. So when we think of cure, at least when I think of cure, I think of the Western or the allopathic approach, where there's a search to heal or cure symptoms or signs of disease. Healing, on the other hand, which is part of the holistic tradition, often engages Eastern traditions, and it is a process of integrating and bringing forth right relationships to achieve a wholeness of body, mind, and spirit. The practitioner is an important part of the healing environment. And as people embark upon their journey to become a healing touch practitioner, they develop and deepen qualities that perhaps initially called them to do this work. So, for example, someone who is honest, caring, compassionate will learn how to become centered, to be balanced when they're giving a treatment, to be very respectful of themselves as well as their clients. And we learn to become very aware of subtle energy. And all of this is wrapped up in a great spirit of integrity. So the history of healing touch. Well, healing touch grew out of the nursing practice of Janet Menken, who was an American nurse. And it is founded in both the nursing process as well as in compilation of a number of traditions from ancient healing. So, for example, we use the chakras. We talk about how the energy flows. And we have an extensive reading list when we're going through our process of certification that encourages people to learn about some of the different histories and gifts that have been brought by the ancient wisdom schools in regards to healing. So it was developed into a continuing education nursing program through the American Holistic Nurses Association, which we refer to as AHNA. And I'm sure many of you have heard of AHNA, especially those of you who are CHNA members. In 1989, the first pilot was organized at the University of Tennessee as well as in Gainesville, Florida. And in 1990, AHNA launched their certification program. So from 1993 to 1996, the certification of healing touch was provided by AHNA. In 1996, however, AHNA transferred this certificate program to Healing Touch International. And I'm going to share a little bit about part of the reason for this is that Janet, who was the founder of this modality, felt that it shouldn't be just confined to nurses. It should be something that if other people are interested in offering to family members or just interested in doing the work as service in their community, that they should be able to do that. And so the American Holistic Nurses Association realized that this was a wonderful opportunity. However, because it was a nursing organization, it could not certify non-nurses. And so we had the creation of Healing Touch International, which provides the education and certification of both nurses and non-nurses in the modality of healing touch. And this little piece of information here, the National American Nursing Diagnosis Association in 1994 brought forth and introduced the nursing diagnosis of disturbed energy field. That was a very important occurrence for those of us who offer energy work, biofield work to our clients, because we are required to do documentation. And so this diagnosis of disturbed energy field enables us to write on our documentation what we may have noticed as part of the client's reason for wanting to have healing touch. We've noticed a disturbance in their energy field. In Canada, healing touch was brought forward by two individuals, Alexandra Johnson and Susan Morales-Kosenek. Susan had met Janet through AHNA and had shared this meeting with Alexandra. Both Susan and Alexandra were living in Toronto at the time, and Alexandra contacted Janet and asked her to come to Toronto, which she did. She offered her first class in healing touch in September 1990. As a result of this, the Healing Touch Foundation, Healing Touch Canada, and the Healing Touch Association of Canada were all formed. And I'll just share another little piece of interesting information. The group of individuals went on, several of them, to become instructors. And one of the instructors, who is still an instructor today, Ava Zawitsky, was responsible and credited for initiating the celebration of International Healing Touch Day, which occurs every March the 6th. So thanks, Ava. I'm going to move along to our vision statement, which is spreading healing, light, love, and restoring wholeness to Earth. That's our vision. We have quite an in-depth mission statement, which I'm not going to go through, but at the end of the presentation, I will show you the website where you can go and look at it in your own time, should you be so inclined. Core values. This is something that I feel is very important, that this organization embodies the core values of integrity, heart-centeredness, self-care, respect of self and others, service, community, and unconditional love. I'm proud to be a member of an organization with such wonderful core values. So, as I mentioned a little earlier, the AHNA had passed on the education and certification of Healing Touch in 1996 to Healing Touch International. And this slide is a little confusing perhaps to some of you, but I'm going to clarify that in a couple of minutes. So Healing Touch International is a professional nonprofit organization for healing touch. And it develops annual conference and professional development courses and is responsible for our international standards of practice and codes of ethics. It coordinates research and also is available for consultation in integrative healthcare. So here are some of our classes that we've offered throughout the world in Healing Touch. It is a standardized curriculum. It is available to anyone, any level of nursing, and is a continuing education program for CE credits. It's open to healthcare professionals, and as I mentioned, to anyone who's interested in healing and learning this modality. We have students in several countries of the world, and we have students in Australia, New Zealand, Japan, South America, United Kingdom, the Netherlands, and of course, North and South America. The certification program involves 5 levels of classes. And the first couple of classes usually can be taken in a short space of time. But once we get up into the higher levels, we do need some time to integrate the more complex theories. And as well, we also have an internship, which needs to be undertaken for a period of at least a year under the auspices of a mentor. These classes, as you see, are offered in communities all over the world, hospitals, and university systems. So, certification for Healing Touch Practitioner, as I mentioned, there are 5 levels in order to complete before you can submit your information, all the work that you've done. It's a rigorous and standardized multi-level course of study, and we use a portfolio application because we feel that is the best way to determine how a person perceives what they're offering and assesses how they are doing with regard to offering Healing Touch to their clients. We have approximately 2,000 certified Healing Touch practitioners worldwide. And for those people who are interested in getting even more involved, you can go ahead and become a Healing Touch instructor. So again, this involves 5 levels of instruction to learn to teach the 5 different levels of the certification, the practitioner program. And after completing those levels, you need to observe other teachers as well as co-teach, and then you are observed doing your solos. So I'm happy to say we have approximately 200 certified Healing Touch instructors throughout the world. And as I mentioned, this program has been endorsed by the American Holistic Association, Nurses Association since 1997. So as I said earlier, Healing Touch International has a new name. We are doing business as Healing Beyond Borders, educating and certifying the Healing Touch. And we decided to rebrand and change our name because there was some confusion between Healing Touch International, which is a nonprofit organization, and a private company, which is now known as Healing Touch Program. And so there was confusion with the general public as to, well, what's the difference and who does what? And so we are the international nonprofit professional organization, and we consist of students, practitioners, and instructors from around the world. And I have to say, it's a wonderful, wonderful organization. It offers people the opportunity to network with people who are doing the same work in other countries. And it just broadens and expands one's own experience. Going ahead to research, the research was initially established in 1996 with a grant from the American Nurses Holistic Association. So the history of research was that there was interest in practice issues and program evaluation, and I will say that initially we used some of the therapeutic touch research because both therapeutic touch and healing touch are based in nursing. They're nursing-based energy therapies. Over the last 15 years, there's been a gradual evolution and sophistication, and we're happy to say that we're second only to therapeutic touch in the number of research studies that have been completed. And to date, there have been over 90 of these. The types of studies that are in part of our research, their methods are quantitative, qualitative, and mixed. The groups include randomized control groups, single groups, patient satisfaction surveys, as well as program evaluations. And this is something that we are really quite happy and proud to share with you. It's our Healing Touch research brief, published by Healing Beyond Borders. The resources we use are publications in professional journals, educational resources such as doctoral theses and doctoral dissertations and master's thesis. And here's our website. I'm going to be showing you this website again at the end of the presentation. But if you're interested in finding out a little bit more about research in healing touch, here's where you would go: www.healingbeyondborders.org. So the research brief contains abstracts of completed studies as well as those that are still in progress. The published information contains a review of healing touch studies, which try to determine how healing touch actually works. What makes it work? Surveys and how healing touch is used or received in various settings, and also focus on the use of healing touch with clients having specific problems. And I'll just share with you right now that in the last couple of years, the healing touch practitioners at Scripps Hospital in San Diego concluded a highly successful research on how healing touch benefits veterans who are suffering from post-traumatic stress disorder. And you can find this information in our Healing Touch research brief. These are two of the individuals who are who use healing touch in their practice, and they have been at Scripps. They were involved in the studies that I just mentioned. Brownie Printon King is a healing touch practitioner and instructor, and she works alongside Dr. Mimi Guarneri, who's a cardiologist. And these two individuals have taken healing touch and taken it a step higher, in that they have been very instrumental in the formation of the Academy of Integrated Health and Medicine in the United States, which is moving complementary and integrative healthcare forward. So really wonderful to see where things can go. So I'm going to review some of the goals of healing touch for the patient. As I mentioned, it helps to reduce anxiety, promotes comfort, it can reduce pain and facilitate pain management. It potentially can reduce complications, but it really encourages clients and patients to participate in their own healing and program of care. For the staff, one of the things that we talk about is self-care. And when you look after yourself, physically, emotionally, spiritually, and intellectually, you're much healthier, you're much happier. And so you're able to, it increases your well-being, it promotes reduction in sick time, and reduces burnout and anxiety, as well as promoting healthier relationships. It supports values and standards that really make us better citizens of the world. We're not looking for short-term gain, we're looking for long-term success. And that, of course, spills out into our community and eventually into our world. So as I mentioned, the vision of Healing Touch was to spread healing worldwide and recreating wholeness on earth. And so being part of the Healing Touch community as a student, a practitioner, or an instructor will bring you into leadership roles within the healthcare system as well as your own community. And we pay it forward, enhancing healthcare and wholeness in the worldwide community. So this PowerPoint was put together, not by myself, but with many other people. And these are some of the people who were involved. Most of them are members of the Healing Touch community. And here is the website and the information. So anyone who's interested in Healing Touch in Canada, this is the website and information. You can contact Angela Mathos at Healing Touch Canada at healingtouchcanada.net, sorry, HT Canada, and Healing Beyond Borders. I'm going to leave this slide up and turn the forum open for questions, if anyone has any questions or would like to discuss anything.
Thanks, Mary-Cathrine. This is Judy Piggott from Langara College again, and appreciate your very thorough coverage of history of the Healing Touch in Canada. I have not received any questions yet in the chat, so
Okay.
anyone who has a question, by all means, pop it in there. We'll give a couple of seconds to see if you've stunned them all with your excellent presentation. And
well, I have to give credit where credit is due. So the executive director of our organization.
uh-oh, we've lost her again. Yeah. Looks like Mary-Cathrine's, oh man, service has been dropped again.
Yep, I've stopped recording. So, and if she does jump back